Oops. Okay.
All right. Ladies and gentlemen, Mr. Allan Gonzales with his presentation, RT Education in the U.S. during COVID. During COVID. So, if you guys have any questions, please feel free to use the um, comment the chat box on our YouTube channel. And also, please stay tuned towards the end of the show. We have our humble 1,500 pesos for our lucky winner for today. Mr. Allan Gonzalez, take it away, please.
Okay, thank you very much, Michael. Again, my name is Allan Gonzales, and I'd like to talk about the RT education right now in the US during COVID. But first and foremost, I want you guys to know that this is informational only. This is not a research study, nor it intends to be. This is just a firsthand or eyewitness account on my lens, my viewpoint, my narrative as a personal experience as an educator. And just think of it as a conversation amongst colleagues online. Our agenda for today, I mentioned about the purpose and then, the RT profession who supports us. The types of RT education in the US, you'll be surprised for those who are not familiar with the RT education that it is so different compared to the RT education in the Philippines, which is a straight bachelor's program. And then I'll call a reality check on what's really happening. And then what is the norm? So in order to compare what's happening, during COVID, we need to know what was happening pre-COVID. And then also the board exams, licensure, challenges that face the RT educator, a little bit of a summary, and then of course our Q&A afterwards. And then when we're talking about RT educator, here in the US, there are two types. One is an RT educator in the hospital, and then the other one, the RT educator, or actually, educational faculty in a school or college. So that's what we're going to talk about, and not the RT educator in the hospital setting. First and foremost, the organizations that are supporting the profession is the AARC, which is the American Association for Respiratory Care. They are doing nationwide representation of our profession and its members. The reality is, unfortunately, not a lot of people are being members of the AARC. So that's one of the things that we are trying to convince our fellow respiratory therapists to become members. Just because for them, a lot of our, unfortunately, a lot of our colleagues are just kind of saying, "What's in it for me?" I don't see any improvement in my salary, in my profession. So unfortunately, there is a small population that does not believe in supporting the national organization. And then each state has their own respiratory care society. Me being a resident of California, I'm also a member of the California Society for Respiratory Care, or the CSRC. There's also a National Board for Respiratory Care. This organization creates and administers our board exams. And then you have the COARC, the Commission on Accreditation for Respiratory Care. This organization regulates and monitors compliance of all RT educational institutions in the US. So we answer to them to make sure that we are compliant in our practice in the field of education. Now, the one thing that's cool about our profession is we are partners, and we have sponsor organizations that support our profession. First and foremost, and not necessarily in any order, is the American Society of Anesthesiologists. And then we have the American College of Chest Physicians, which are composed of, cardiologists, pulmonologists, any type of chest or trauma surgeons. And then, of course, the American Thoracic Society. Again, any medical doctor that deals with the chest or the thorax. Okay, so even though it seems like it's the same, the ACCP and the ATS, totally separate organizations. So, what are the types of educational institutions in the US? So, first and foremost, we have to ask ourselves, are they regionally accredited or nationally accredited? What's the difference between the two? Okay, which do you think is better? Okay, so on my end, it's subjective. Both are good. However, there are advantages and disadvantages in each of the accreditation or accrediting agencies. So we'll talk about first the regional accreditation. As you can see here from the map, the United States is divided into different accreditations. For example, where California is located, we have the WASC, or the Western Association of Schools and Colleges. There are only two states members of that area, which is California and Hawaii. And then each area has their own accreditation agencies. So what do these do? These are majority of the members of the regional accreditations are your typical schools, colleges, and universities like California State University, UCLA, New York University, Stanford, Harvard, Yale, Princeton, University of Chicago, Houston University. So those are when you attend those types of schools or colleges or universities, and not just universities, but also high schools. These are accredited by the government. Okay, so they are. You take a course here, it'll be transferable to another school. Okay, so in our area, we have the WASC. So again, the difference between the two is if you take a course in English, let's say from a university in somewhere in California, if you go to New York, most likely that will be credited. As compared to a national accreditation, majority of the members of a national accredited school are private schools, for-profit private schools. Some of them are known as technical or vocational schools or colleges. And most of their courses and programs do not transfer over. So that means it's only good for that institution. So if you go to that school and you want to transfer to another school, most likely they won't take in your credits. You have to start all over again. Okay, so where I work currently at San Joaquin Valley College, it is a private school. However, we are regionally accredited as compared to another school that I worked at was national accredited. If you take classes there, it won't transfer over to other schools or universities. So the most sought after educational institutions right now are the regionally accredited schools, just because of the numerous opportunities that's being provided. Also, is the RT program a 4-year program, 2-year, 18 months? Is it on campus, hybrid, or is it an online program? Yes, you would probably raise your eyebrows and think, what? There's an online program for RT? How does that work? We're dealing with patients. How can you be online only as compared to if it's a face-to-face, you have to deal with equipment. So how does that work? Also, does your institution offer an associate's degree, which is usually the 18-month or the 2-year? Does it have a bachelor's program? Also, sometimes we call it degree advancement. Now, there's a lot of universities now that offer a master's in respiratory therapy or respiratory care. And then also, there is an advanced practice respiratory therapist. So these are almost like the equivalent of a nurse practitioner, meaning that you are a somewhat independent practitioner. Okay, you could do some surgical procedures if necessary, or other types of invasive procedures on your own. Technically, however, you're still under the practice of a physician, but you just have more scope. Is it a full-time or a part-time program? Okay, so other schools offer a part-time program, especially for those who are working, the working professionals. Now, will the school or the student pay for board exam preparation seminar? So those are the stuff that applicants are considering. Who pays for it? Will it the school or is it me out of pocket? Practice board exam, the actual board exams, the licensing application, any type of supporting documents. So, for example, again, I don't know what is required to be licensed in the Philippines, but I'm pretty sure you guys get some sort of like the NBI clearance, police clearance, barangay clearance, or other types of photo ID. So those are things that applicants consider when choosing schools. The actual RT license, okay, is it going to be paid for by the school or by the student or the graduate? So depending on the school that you're going to, the total cost of an RT education ranges from anywhere between $5,000 to almost $80,000 total, and that includes books, tuition, and other supplemental fees. Now, this is the reality check. So what we hear from students as an educator is, especially if they're applicants or once they are in the program, is I am here to prepare for a job or I am here to prepare for a career. I'm pretty sure this is kind of a no-brainer. Which one are we? Are we looking at this as a job, then we're done? Or is it something that we are more dedicated to the profession of respiratory therapy, that we look at this as a career option for us? Next thing that they ask, and as you can see, some of them are bolded. Those bolded ones are the most common that I encounter, the types of questions that I will hear from students or applicants. How will I be supported by the school? So these applicants are looking for, how are you going to help me pass my class and graduate? That's the bottom line. Next is, are instructors available after class? Okay, so some schools, when you're done, instructors are available X number of hours per day, or, times, how many days per week. Okay, sometimes we call them office hours. In some private schools, after class, your instructor is available to you until the end of business day. Okay, so students still like that face-to-face interaction with the teachers. Okay, so next is, are tutoring available? So again, if they are having a hard time, then they do expect, especially if they're paying or if they're going to a private school and they're paying big money. Okay. Now, on the side, I would say that majority, if not, I would say more than 99% of the students receive financial aid from the government. Okay. So technically, they don't really have anything out of pocket because they get financial aid. However, that aid doesn't necessarily equate to your education being paid in full. It'll depend on your background, your ability to repay the loan, and other factors. Next is there a career center at the institution? Will the school help me find a job? Majority of the schools here in the United States have some sort of a career center or career services department in which their only job is to contact different hospitals, different types of medical institutions, asking, do you guys have any openings? And they try to sell, our students or our grads so that they will be hired. Okay, so that is one of the things that applicants are looking for in a school is, will the school help them find a job? Then other stuff that you will hear from students is, what if I have work and can't come to class? For me, that is, it doesn't sound well. I usually tell, if I'm interviewing applicants, my school, we interview applicants before they get accepted. When I interview them, I always tell them this is a full-time job. This is a Monday to Friday, 8 to 5 type of class. So technically, you don't really have time to work, and I discourage you from working. However, we don't pay their bills. A lot of them are working students. A lot of them are parents. And some of them are high school grads. Some of them are 18 years old. So they have a life. And they, the challenge for them is balancing home life and school life. What if I can't come to class due to childcare? And that's very common, especially for students who have children. Some of them are single parents. Some of them are, has a spouse or partners in life. that can't provide childcare. So those are stuff that students will miss class because of that issue. And of course, my car won't start. My child is sick and I can't come to class. I just had this recent one. I overslept and missed the class, missed the exam. So what do you do then? Of course, it's you would think, well, it's kind of a no-brainer. Then they get a zero. I understand that, but later on, you'll see that there are other factors in which students, you will kind of have to bend a little bit depending on the institution that you're working for or where you're working at. I got snowed in. Unfortunately, or luckily, I guess, we don't have that problem here in California. However, in some parts of the United States in which there is snow, this is a big deal. I'm sick. Usually, if you're sick, hey, go to the doctor or can't attend class. You're absent. You don't get a zero. You get a zero for an exam missed. You didn't submit an assignment, you get a zero. However, because of COVID, there's a lot of changes right now, a lot of accommodations being made to the students. And is it good or is it bad? Again, this is something very subjective. I have my own personal opinions regarding that. However, out of respect for our COVID patients or those who have experienced COVID, I will hold on that one. This is something that, in general, you guys want to think about if this is a good excuse or not. Or a family member is sick, same thing, COVID or non-COVID, or a family member died. I remember before I had a student who said that, their grandparent died or their mom died. Okay, fine. And all of a sudden, a few weeks later, their mom died. So a few weeks later, their mom died. So they got three mothers. But here in the United States, it's different because sometimes some students are adopted. So they may have a biological mother, they may have a stepmother or an adoptive mother. So it's hard to judge. It's hard to give a decision whether you're going to give the student a break or not. One of the things that I love students saying is, do I need to get a lawyer or will I get my lawyer involved? Okay, they try to intimidate you. If things are not going their way, okay, they'll say they're going to sue the school, et cetera, et cetera. So again, it's up to you to deal with that type of student. It's just too much. It's too much reading. And of course, can you just teach what's on the test? We can't do that as an educator. In the hospital, if you're working, you can't say, oh, I didn't read this, and this is not on the test. This situation, this procedure was not lectured on. Okay, so you're given a chapter to read. So when they ask me, is there any specific pages you want to concentrate on? Yeah, it's chapter 1, which is basically pages 1 to 30. Is there anything specific topic? Yep, the topic that's between pages 1 to 30. So I had to generalize all my answers, because if you say a specific topic to one person and you didn't do it for another, there's a lawsuit there just because of it's a discrimination. You're providing information to one student and the other student's not getting it. So I've learned over the years to generalize my answer. So they say, hey, Professor Gonzales, what do we need to study for? My simple answer, everything. And of course, the students will have so many questions on and on and on. As you can see there at the very end, I put the infinity sign just because, questions, concerns, complaints will never end. And then you have the FERPA, which is the Family Educational Rights and Privacy Act. Here in the United States, once you turn 18, you're an adult. Even if your parents, or even if the student's parents are paying for the education and they want to know the status of their child at school, we can't give them details because of FERPA, unless they sign a waiver that will allow us to communicate with parents or some other adults. Other than that, we can't communicate because of the students' privacy laws under FERPA. So I have, a student recently, a student failed, had to be terminated from the program, AKA kicked out of school. And parents wanted to know, hey, what's going on? I'm paying for my child's education. I need to know. And all we could say is, sorry, your daughter did not sign a FERPA agreement. So we can't tell the parent details on why the student was expelled. So what's the norm? Okay, so now we're going to talk about the norm so that once we talk about this, then later on when we talk about uh, RT education during COVID, you could make a simple comparison. So prerequisites, depending on the institution that the applicant is entering, some of these prerequisites should be completed prior to entering the RT program, or in some programs, it is already embedded in the program. So you're taking all the prerequisites, and most of this are your private schools. The completing of the prerequisites prior to entering the program are mostly the regionally accredited type of institutions, as compared to the ones embedded or included in the program are the your technical and vocational schools. Schedules, again, pre-COVID, of course, everything is face-to-face or live on campus, unless you're in an online program. Usually it's called, the course of study is by semester or terms, which is about 15 to 18 weeks, depending on your institution. Or sometimes they call it modules, which is about 5 to 10 weeks. They go to school almost 4 to 5 days a week, between 4 to 8 hours a day. Could be a morning program, afternoon, evening, or even weekend classes are available. And then the hands-on are in the laboratory on campus. Clinicals typically is about 24 hours a week, or 2 12-hour days, or 3 8-hour days. Depending on some institutions that are like far off, some are even doing 5 days of clinicals, 12 hours each day. Students are responsible for their transportation, food, and sometimes lodging. Okay, so where does lodging takes place? In some schools, they have clinical sites as far as 150 miles. And I Googled it, it's almost the equivalent of 241 kilometers away from the school. And at my institution, we have a 90-mile radius from the school where students can be expected to be assigned. Now, one of the drawbacks of an online program is these students who attend the online program, they have to find clinical sites for them to do the rotation, which is really, really tough. And I feel bad for them. I mean, some of them are successful. So it's like going to a hospital begging, hey, I'm in this program. Will you accept me as a clinical student? Some say yes, some say don't. And that's the challenge for the online programs. So what happened during COVID? For a brief period of time, schools closed. Clinical sites closed due to the upsurge of COVID patients. Everyone stayed home. Students' education and graduation got delayed. So because of that, earning potential got delayed, or even the earning potential is lost, gone, okay? And everyone got stressed and frustrated. So imagine being stressed and frustrated, no income, all of a sudden now they said, okay, let's open up. So during the initial opening of schools, classes resumed via Zoom, Google Meet, or Microsoft Teams. Hands-on laboratory was replaced by watching YouTube videos, or use your imagination. Picture in your mind or pretend you're doing this procedure. That's going to be tough because even though you kind of picture it, you're doing, a ventilator check, a nebulizer treatment, intubation, but you're not holding it. Okay, it's just everything's in your mind, and it's not a bad thing, but of course you need the hands-on. So over time, there's now a gradual opening. So lectures continued via Zoom, Google Meet, or Microsoft Teams, or sometimes even Skype. Okay, on-campus laboratories resumed with social distancing guidelines. So that means, for example, in my school, one classroom, you could accommodate 30. However, because of social distancing guidelines, they made calculations, square footage of the rooms. You could only allow up to 11 people per room. So that's one teacher and 10 students. So that means it's tough. It's time consuming. Pre-COVID, all 30 students are there practicing hands-on. During COVID, instead of the teacher being there for, let's say, a 2-hour lab, the teacher now has to be there for a 6-hour lab or more, just because the first 2 hours, only 10 students could attend. Afterwards, there's like a 15-minute break, cleaning stuff, disinfecting, excuse me. And then the next group of 10 students come afterwards, cleaning, disinfecting, and then the last group of 10 students for another 2 hours. So it occupied the entire day, the entire time for a faculty member. Okay, so what we did was we hired new grads as laboratory assistants, even without RT experience. Of course, the salary is a little lower, the wage is a little lower as compared to a seasoned RT veteran, so to speak, like the clinical instructors or the part-time instructors, but they're there to help out. Okay, so that made it a little bit more manageable. Exams are all online. So is it proctored or non-proctored? Is it recorded or non-recorded? Right now, a lot of schools are going away with the proctored exams or the recorded exams, so they want the exams on campus. Lectures could be still done online, but when it comes to testing, have them go to campus. So same thing. You can't test 30 students in one classroom. It has to be divided into 3 groups. So the challenge there now is, what if one group comes in and then the other group is going out and they talk about the exam? So we have to think of creative ways to make sure that one leaves in one door in one side and the other enters on the, at least in my school, we're like in the middle of the hallway. They could get out from another door while another group of students are coming in and they can't talk. And we have to have faculty outside to make sure that they don't mingle. So timing is very important. So during class, so imagine this, you are teaching online, again, via Zoom, Google Meet, Microsoft Teams. How do you know your students are actually in your class? They log in, you see a little square on your screen that they're there, their name is there. So the question is, are they at home or are they at work? A lot of students admit they log in, then they do their own stuff. They're at work, they log in, they put their phone down, and then they work. Okay, so their camera's not turned on. So you would say, then have them turn the camera on. Okay, and a lot of stuff, a lot of schools could get away with it. However, according to the U.S. Department of Education, we can't force students to be on camera because it is a violation of their student privacy. So that is another challenge that we have to face. Next is attendance check. Right now at COVID, if you have, let's say, a 3-hour class, if you log in, so let's say from 8 to 11, hypothetically, if they log in at 8 o'clock and leave at 8:05, the fact that they were there, it's documented that they were there. You have to give them attendance for the entire class period. Okay. However, there are some ways that we could go around it. So let's say, okay, they're present, but I'll do an exam at the end of the day, or a quiz, or any assignment, a simple question to see if they're listening during lecture. And then they submit that. So they would get attendance. However, for those, let's say, who are absent, and then all of a sudden their classmate texted them, hey, the teacher's, doing an activity. And you log in, you submit the gradable work, any type of gradable work, okay, and then log out again, that's still in attendance. And it's very frustrating for the educator, for the instructor, just because they're not there. And then all of a sudden during exam, they fail, and then they blame, guess what? The instructor, okay? Or I didn't know, just because I didn't know that we have to do this. Well, yeah, you didn't know because you didn't attend class. Okay, so the attendance check right now during COVID is probably one of the biggest frustrations for the RT educator. Just because as long as they show up, even for a few minutes, you have to give them attendance. They are present. If they don't attend class, but they submitted work for that day, and we're talking about from, 12 a.m. until 11:59 p.m., you give them attendance because they submitted, there's a recorded submission of a gradable work for that particular day. So a student, hypothetically, could not attend class and still pass the class by just submitting work or passing the exams. However, of course, there's a disclaimer to that. Some institutions, if you're absent consecutively X number of days, then you'll be terminated from the program. And then for us, it's about 15%. If you miss 15% of class time, you're out of the program. So during testing, how can you protect the integrity of your exams? First and foremost, students can do screenshots from their phone on the computer, copy and paste. They're texting their peers, sharing answers. How can you prevent that? So you need to find creative ways to make sure that exams, although the percentage is big, what if everybody's passing, but sometimes you have to believe your gut. Sometimes it's telling you this student is not grasping the lesson, but they're passing the exam. So what's going on there? That's why for us right now, not only are we big on the exam, something a little bit bigger is what we call learning objectives exam or hands-on. They go to the lab, they demonstrate a procedure. So skills testing. So we resorted to skills testing. Then, it's fair game now because now they're on campus. Also, during exam, is it timed or non-timed, set time frame, or on or before? I put it in quotes, on or before 11:59 p.m. Right now, our instructors are cutting down on to make sure that they're there. When I say they're not on campus, but on the computer, you could only take the exam during class time from 8 to 11. However, other instructors are still saying, hey, you know what? Just take the exam as long as you do it before 11:59 p.m. It's good. And there's nothing wrong with that. But that's one of the things that you as an RT educator has to, or at least us here in the United States, as RT educators, what are you willing to do? And what type of policies are you going to make? And that is we have the freedom to decide on that one. So is it a closed book or notes or open book exam? Okay, so again, that depends. People say, oh, let's do open book. Yeah, but if it's open book, but you're timing them, you're only giving, let's say, for a 15-question quiz, you're only giving them 10 to 15 minutes. They don't have time to look up in a book. And all of a sudden, of course, they will complain because there's not enough time. I said, well, if you've studied, it doesn't matter if you open the book or not. You should know. Last is also technology issues. This is a big thing. Oh, I wasn't in class because my computer's not working. My computer crashed. That's why I wasn't able to submit the homework. Can you give me an extension? So again, where do you draw the line? Would you believe them or would you not? Okay, so those are the questions that you kind of have to think about as the RT educator. Upon their graduation, okay, in any of the programs in the US, these graduates are now eligible to sit for or take the NBRC board exam. And the board exam consists of two exams. One, we call it the TMC, or the Therapist Multiple Choice. And then the other one is the CSE, or the Clinical Simulation Exam. So see if you could follow along with this one. If the student passes the TMC at the high cut score, they earn the designation of CRT, which is Certified Respiratory Therapist, and is eligible to take the clinical simulation exam. If they pass the clinical simulation exam, then they earn the designation or title of RRT, or Registered Respiratory Therapist. Once you are an RRT, you can now apply for a license to practice respiratory care in your home state or whatever state you live in. The drawback to that is if you move to another state, then you have to pay the license for that state. Each state has their own licensing laws and licensing fees. However, if you pass the TMC at the low cut score, okay, so there's two scores on the TMC, a high cut and a low cut. If you pass the low cut score, you're still a CRT, and you could work or get a license in the states that does not have the RRT minimum eligibility, which is still the majority of the states. Okay, majority are still. There's only about 6 states that requires RRT as the minimum. So before we go into that, these are the other different credentials that you could earn through the National Board for Respiratory Care. So again, you have your CRT, your RRT, And then you have your NPS, or the Neonatal Pediatric Specialist exam. A lot of our children's hospitals in the US are now requiring applicants or their employees to have the NPS. Or if you don't have it, usually they'll give you a time frame like 6 months within hire. And then you have the ACCS, or the Adult Critical Care Specialist. You have the CPFT and the RPFT for registered or certified pulmonary function technologist. Again, this is also one exam. If you pass on the high cut, you are an RPFT. If you pass on the low cut, you are a CPFT. And then one of the newer ones as well is the SDS, or the Sleep Disorder Specialist, for those who are doing polysomnography. So each state has their own licensing laws to practice respiratory care, and the fees vary by state, ranging from $75 up to $300 for the initial and the renewal of license. Usually renewals about every 2 years. So guess what? Who has the highest licensing fees, which is the $300? California. Okay, and then the other states are, again, within that range. There are 6 states that have the RRT as the minimum entry to licensure: Arizona, California, Ohio, Oregon, New Jersey, and New Mexico. So if you are a CRT and you're not an RRT, most likely you will move to another state, just because you can't work in these states if you're a CRT only. For those who can't pass the board exams, or does not wait, well, not pass, but because you're still encouraged to be a CRT. But for those who do not want to pay licensing fees, then move to the state of Alaska. The state of Alaska is the only state that does not require licensure. So what are the challenges that faces the RT educator? First and foremost, we have to think, what if we go back on campus and do face-to-face learning again? Will we have the same number of students? The reason I say that is because one of the challenges right now is, because of the online, students took on employment. Instead of being on class, since they can submit work later on, they took on more work to earn more money. And again, I'm not judging. I'm not saying that you shouldn't, but it's a decision that they made. Next is, how can we motivate, or how do we motivate our students right now during pandemic? Online learning. They need that face-to-face and live connection. So we have to create activities, and sometimes we have to invite them on campus for small talk, just to have that live conversation. Next is, what sacrifice are we willing to make? As the educator, again, instead of spending 2 hours in lab, you're now 6 hours on campus. How do we balance our obligation to our students versus our obligation to the school as the employer? You have one student who's failing, or you have one student who has, I've encountered one student in the past, not in my current employment, who was so frustrated he punched a hole in the wall in the school. Hey, for me, that's vandalism. However, policy states that that student should have been terminated or expelled. However, school administration said, nah, let's give him another chance. So he had to stay. However, we wanted to make sure that he would not become belligerent or even violent. If not, not only will he be expelled, but we will call the authorities on him. Next is, where do you draw the line? Academics, ethics, morals, personal time, sacrifices. I know a colleague from another school who asked the instructors, just go past them. They're failing, but pass them, give them passing grades. I'm thankful and fortunate that I've not experienced that. I know what to do, but it may cost me my job. Okay, so again, where do you draw the line? So you have to think about academics, your own morals, your own ethical beliefs and practices. Next is student interaction. How can we be friendly without being friends? I don't want to generalize. However, it's hard to think that students may take advantage of you being kind, or may try to befriend you. And then all of a sudden they may ask for favors. Okay. Next is, how can they take us seriously if we're too nice to them, so to speak? Are you the terror teacher? At first, I said, hey, I want to be like that. However, after learning, after studying my master's, getting my adult learning theory, doesn't work. Number one, yeah, they may do it because they fear you. But for me, I like the students to do the work because they want to. It's not about me, it's all about the students. Okay, so the center of the universe should be them and not you or not me as the educator. I want to make sure that they understand that they're doing this and they're learning respiratory therapy, not only to treat patients, to help people, but to better their lives. So it's all about them. Doesn't matter if I'm happy or not. All I am is I relay information to them. Are you familiar with adult learning theory? One of the things that for me is by nature, adults want to learn, they want to succeed. All we have to do is provide them with the tools necessary to succeed. It is up to them. Will they accept our help or will they resist and not accept our help? But at the end of the day, if you know you've done all your, all you can, your best, your job, then the ball's in their court. And the most difficult of all for me as a program director is how do you balance attrition versus retention? Attrition is drops. And then of course, retention is you retain the students. If students are not passing and they're dropping, as an educator, you would say, well, you did what you can. However, as an administrator, as a program director, all of a sudden, then management will ask you, hey, how come your program is dropping a lot of students? Are you guys not doing your job? Are you not helping them? Are you not reaching out to them? Are you not tutoring them? Okay, so attrition versus retention. You need to find a good balance, again, without crossing academic integrity, your ethical and moral values. And then, of course, other things that we could talk about. How can we improve our practice? Should I attend this seminar, this symposium, this conference? And again, the infinity sign is there. So many questions that challenges us as educators, and they're very exciting once you are now brainstorming of possible solutions. So in summary, know your professional organization. Also, there is a significant change between pre-COVID RT education and the present times. And is it going back to the norm? I highly doubt it. At least not yet, not in the near future. As for RT educators, we must continue to look for resources to help us do our jobs effectively and efficiently. It has to be both, not just one. With the absence or lack of face-to-face contact, we must be innovative in communicating with our students and making sure that the message gets across clearly. We want to make sure they understand that. Not just, do you understand it? Yes or no? No, don't rely on what they say. They have to do it in either an exam, skills testing, oral testing, so we need to create activities for that. Our ultimate goal is to educate, not to judge these students. They have their own narrative. They have their own story. They have their own lives. Why are they doing this? And who are they doing it for? I always ask that to all my applicants. Why are you here? Who are you doing this for? Oh, I'm doing this for my family. I want them to have a better future, better lifestyle. So when they're slipping up, they failed an exam here and there, I keep reminding them, hey, you got to stay focused. Remember, why are you here? Who are you here for? Think of your kids. You have a job right now that pays you minimum wage. Hey, when you graduate, you'll earn the big bucks. Okay, so sometimes those work, most of the time. Next is, how can we support our students to graduate, pass the boards, obtain licensure, and obtain employment? It is a team effort for you, the faculty, the students, your colleagues at the college. Again, if you have an admissions team or you may have a career services team, it's open communication. And that's what I have to deal with, every day. Thank you very much for listening to my personal experiences. I'm also on social media, on Twitter and LinkedIn. I tweet about respiratory and anything under the sun that deals with respiratory therapy or medical. So thank you very much. Maraming salamat po. Michael, back to you.
All right. Thank you so much, Mr. Allen, for that great um, presentation that you have given all of us with regards to the RT education in the US in the COVID-19 pandemic. Sorry. All right. Let me just. So if you guys have any questions, please feel free to use our chat box. We will be joined by our panelists from the three schools that I mentioned earlier in a few moments. So stay with us. So if you guys want to take a quick break, please do so. And then we will be back in about a few moments here as we are gathering all our panelists with our Google Meet here. All right, so we're gonna go for a short break here. I'll see you guys in a bit.